Framework clearly defines the patient as an expert. However, when we talk about the pharma, then we are consumers, and when we talk about the government, then we are beneficiaries. That language needs to change if there has to be a collaboration with patient groups. We are not consumers, we are not vendors. Including patients right at the beginning, and there is a language change, a mindset change, and a behavior change. It's very difficult to have a partnership. Now, partnerships and collaborations are already happening with medtech, with health tech, with pharma, with government, but each of that is in its silos depending upon their business outcomes. It's not the health that is there as the ultimate goal. So when people look at health and health of the individual, health of the community, and health of the nation as an outcome, then I think this silo partnership will move out, and there will be integrated collaborative partnerships that actually look at the whole nation achieving a health outcome that's beneficial to all, whether it's a business goal or whether it's a personal goal as a person who has that particular disease and who wants a good outcome. The last point that I want to stress on is when we look at Amrit Kal, it's not treating people with AI or nanotech or bots. It's how do you prevent the disease. I want people to be healthy. I want nation to be healthy. So can we look at AI, digital, medtech, whatever we have as a future to prevent diseases, to be able to predict diseases so that we have lesser people becoming sick?
My next question was going to be to you, but I guess we have about 1.5 minutes left. But I will ask you the question anyway for you to answer and perhaps have closing comments from everybody generally on this topic. So in what ways can we empower patients to play a more active role in their healthcare? And how will the increasing availability of health data, patient autonomy, impact patient autonomy and decision making? That's something I thought I will ask you to comment before I kind of ask every member to give closing comments on this topic. Please.
Okay, I'll quickly say what I have to say about empowering patients. First is to recognize patients as part of the ecosystem. I think right now, neither the industry nor the government recognizes us as part of the ecosystem. So once you recognize, how do you enable? So do we have a system where patients are able to understand what they need to ask or what they need to do regarding their healthcare decisions? The enabling is also to make patient organizations sustainable. Right now you have event-based sponsorships or you have very short sponsorships, and that doesn't give sustainability. And patient groups are not recognized by the government as equal partners to have projects with the government. So I think both ways, both partners have to work. Encourage us. I think that encouragement is missing. Please encourage patient groups to become independent and function as independent institutions that actually bring that expertise to the table. Then educate us. We do not have institutional mechanisms to enable patients to educate themselves on what drug discovery is, what health technology is, or what pharmacovigilance is. They do not understand. They are passionate, but they do not have the tools to be able to dialogue on a patient advisory board or on a health technology advisory board. And most importantly, please execute the promises that you make. Most promises are broken after they are made. Thank you.
Brutal. We get very bad reviews immediately put out the first app. So patients are directly involved in, and I get bad advice everywhere, right from investors to patients to colleagues to employees to partners. So what we realize, what really works in involving the patient is a ACO framework. Awareness, choices, outcomes, and the data drives all of this. Getting aware is a process, getting educated, understanding your risk, understanding predictive, and their data is humongous. And in our first version of the app, we gave so much of data to patients, they got confused. So data itself is one of the problems, but how to visualize the data in a meaningful way for a different set of patients is the problem to be solved. Then based on that data is coming from devices, data is coming from blood tests, data is coming from doctor consultations, your app interactions, everywhere the data is coming from. How do you trigger a plan which is AI and generated at scale, keeping the sensitivity of cost effectivity? How do you give choices, meaningful choices for that patient at scale so that they can get the outcomes? Now, outcomes is very misunderstood. A lot of time doctors are giving only HbA1c, for example, an outcome, but patient is looking for something else. Stress, sleep, productivity, happiness, quality of life. So I think this ACO framework, if you implement awareness, choices and outcomes in every therapy, I think we'll be successful.
That's very useful. Thank you. And I think we've run out of time, but instead of passing it to everybody, I will request you, Mr. Jain, to kind of give your closing comments, and then we'll wrap up this panel discussion.
So thank you very much, Suresh, and thanks for the outstanding panel, what we had. Three key messages which I take from here. Patient is the center of everything what we do. We exist for patient, point number one. Point number two is collaboration. Whether it is government or industry, whether all sectors of the industry, collaboration with patients, collaboration with academic organizations, that is the second factor which becomes very, very important. And the third is, we are at the inflection point. This is the decade for India, and India will play a primary role in becoming the healthcare destination of the world. Thank you very much.
So much. Request you to come together for a picture while I invite Mr. Manoj Saxena, President-elect OPPI, to please join us on stage. Ladies and gentlemen, let's give it up for this really insightful panel. Can we have a big round of applause for them? Thank you so much.
The value proposition for the patient, which in turn is actually in a form is actually we are running after society, because we are creating knowledge, we are dissipating knowledge, and that knowledge is actually translating into the value for patients, and money automatically comes from there. So all these are areas where a lot of scope is there for value play. But we need, as I said, a lot of money, the mindset shift, and beyond this we also need a very focused collaboration between academia and industry. This terminology is an old terminology. I know lots of people get irritated after hearing industry-academia interaction. For the last 50-60 years we have been hearing this, nothing much has come out. And the kind of academia which has developed in last 10-15 years in this country, which is very focused around a specific need, if I can say. We have best in technology institutes, IITs, we have best management institutes, IIMs, we have best information technology institutes, IIIT, we have national institutes around the biologics, the genetics. Lot of things are very focused around a focused theme these institutions have been doing. And there is a need for a very strong collaboration with these kind of focused institutes to bring out that play in the
Perfect. Vivek, since this is a topic which is closer to your heart, you also, do you want to add to further on that, and how can we do a better, simplify life for pharmaceutical industry in ease of doing business, particularly from a innovative IP ecosystem perspective? Yeah.
Yeah, I think maybe I'll just build up on what Krishna added with respect of IP protection in India. I think when we are talking about value-based IP and also for a value-based IP for value-based innovation in India, I think, as I said in the earlier point, that it is very important that we need to focus on the quality of how the IP quality is measured at the examination level. That's one part. But I think, we have been talking about the newer technologies, medical healthcare technologies, customized medicines coming up. And I think there is a regulation, a structural regulation, especially policy regulation from Krishna's perspective is on human genetic resources and sharing of that. We do have some kind of a coverage in biodiversity and with respect of that, but there is no streamlined regulation how that needs to be shared, and protected. So I think that is another area that needs to be looked at.
See, there's a lot that can be done. The good thing which I see is that there is more openness with governments to kind of collaborate. Because I can personally say that currently we have some access projects running in 4 states in collaboration with the state governments, which I wouldn't have envisioned maybe 10 years back. So systematized, it needs to become a process, and there are quite a few rigid bureaucratic hurdles that we face, because of which even well-intended initiatives are not seeing the light of the day. So that is something which needs to come in big time as a reform when we talk about ease of doing business. Because at the end, when we talk about access per se in India, it's a big problem. I keep saying this in almost every panel, it takes a village to raise a child. It's not just one organization which is going to solve for it. It's not just the government's responsibility that they will be able to solve for it. Quite a few partnerships will have to come together. The ecosystem has to work together. And do we have a framework and a policy around it is the question. Because many times it's difficult to deal individually with multiple departments and multiple other agencies. Because somebody needs to facilitate that, and that cannot happen through a pharmaceutical industry initiative. It has to happen through the government. There has to be a body which needs to facilitate this.
Yeah. So maybe I pick the brains of Rajiv, where he said somebody from the government has to understand it well. You have been, been in the background doing a lot of work in your previous roles. So what are your thoughts, Rajiv, when we have to really look at, I know there is a policy on incentivizing research now, but moving forward, how do you think India can put more money on the innovation?
Yeah, just to recall, my stint earlier in DIPP, at that time it was DIPP, the first draft paper on EODB was produced in 2001, and I had some role in that. So you see, we have been talking about EODB for the last so many years, but it's only in the last few years we have seen very perceptible and very clear changes and improvements. I mean, some of them are captured in the rankings. We know that the EODB rankings have been discontinued, but now instead of EODB, we are calling it, the World Bank is saying BEE, Business Enabling Environment, larger concept. But look at what has happened in the last few years to get a sense of how fast changes have happened for the better. Now we are 63rd rank. We were 142 out of 100, almost 190 countries. So now we are 63. But look at also the GII ranking, Global Innovation Ranking by WIPO. We are on 40th. We were around 80. In 80s, from 80s to 40 in the last 6-7 years. So what we are now seeing is a very, very, very encouraging sign in building the innovation ecosystem. And I will explain with just 2-3 numbers. There is a 7x increase in the patent grant. Now, again, the issue is quality. I mean, that will come back to the quality angle because that is a major thing. Unfortunately, I will take a little more time. 7x in patents, number increase. Now we are giving 30,000 patents. During my time, we were looking at 2,000 patents per year. So now it is 7x. In design is 2x. In trademarks is 4x in the last 7-8 years. So one is that things have changed for the better. Now financing is a major issue. Larger ecosystem of financing. India spends just 0.7% of on R&D, but we need to go to at least 2%. 2% is what the target has been set. But again, if you look at it, and it's a competing demand, how much we spend on healthcare itself, public healthcare, now we are touching about 2.1% of GDP in India. We should be doing much, much more. See, 2.5 was the target set in 2017 National Health Policy. So we are at least touching that, but you look at it, what is required. From the state perspective, I want to just explain to you that 30% of the total public health spend is from the center, 70% is from the states. And the best of states, I've worked in Tamil Nadu extensively, spends about 5.6% of its total expenditure on health. It should be at least 8%. Now we are going towards it. So that is why my question is, how do you find money for better healthcare and more innovation? And the challenge for that, that's again the good point, the silver lining is that there is a lot of the startup culture, the money coming out of that is helping it. Keep the trend on. The first question was that India is the growth engine for the world. So that is why healthcare is the most crucial thing that we're looking at. So there are good times ahead.
Thanks, Rajiv. Ravi, going back to what you said, India can do better in terms of, if you focus on the regulations, I know we focus on, maybe some examples as to what can improve. Yeah.
So for example, if you go deeper into aspects like trade secrets, for example, where we feel there's a need to have a legislative framework. Our national IPR policy did talk about the time has come for India to have a law around trade secrets. So the challenge, for example, is if I, as an innovator sitting in US or Europe, even having R&D facility in India, generating a lot of data, or I'm bringing in technology from outside and partnering with the local partner, let's say. All our technology transfer happens. Now, whether the existing legal framework gives me enough protection under the contract law or common law to protect me in case there is something goes wrong in terms of protection of my trade secrets. So there's a need to have a supplementary support system in terms of law to give confidence to innovators across the world so that they can come in, invest a lot more than what they're currently doing, knowing that there's a support system around it. Similarly, if you have clinical trial data, if the data is used for other companies, relied upon by other companies to get approval for their subsequent molecule, same molecule, biologics or things like that, is there a kind of an incentive for me to do that kind of clinical trial and be protected in some form or shape?
So how should companies approach conducting clinical trials, not only phase 4, phase 3, but including phase 1 and phase 2. However, I think the operationalization of that policy, the execution of that policy, and we had Shri Rajiv ji here today talking about it, the whole point, as Krishna also alluded to, the operation of the SECs, committees, what is allowed, what is not allowed, bringing that transparency into execution, I think will take us a long way, because conducting clinical trials is the only way that you develop products and bring them to the life. So that's what I see. I think in terms of clinical trials, that operationalization transparency is needed.
Thank you so much, Mr. Saxena, for really keeping the pace of the panel discussion up. I'd like to invite Mr. Anil Matai to please join us and give a small token of our gratitude to our panelists and of course our moderator too. Ladies and gentlemen, can we have a big round of applause to our final panel of the day? And here's reminding all of you to share your key moments from the annual summit using the hashtag OPPI annual summit, hashtag Bharat Ke Liye. We'd love to speak to you, engage with you, and keep the buzz alive on digital as well. your Director Communications and Patient Advocacy from OPPI to deliver a word of thanks to this amazing audience right here with us.
For leadership and guidance. To the OPPI team, our event management team led by Manish, to our creative agency Hufrish, to our PR and digital team Weber, who's sitting right there behind. Thank you very much, guys. And of course to our lovely and lively host Khyati. Thank you for taking this event through. And last but not the least, to our sponsors and partners for their support. With this, we'll conclude today's proceedings. Thank you, everyone, and we look forward to meeting you next year at the next summit. Thank you.
Thank you so much, Asavari. With that, we come to the end of our annual summit. I would once again like to thank each of you for taking out the time and being present here. Congratulations to all the winners. As we look toward the future, our vision is clear, ladies and gentlemen, to become a healthy nation where every citizen has access to affordable and quality healthcare. By 2047, let us aim to fulfill Prime Minister Shri Narendra Modi ji's vision to make India a developed nation where we achieve universal health coverage, ensuring that no one is left behind. Our roadmap rooted in collaboration, innovation, and a commitment to the well-being of every citizen will guide us toward a future where the health of our nation stands as a testament to our collective vision and determination. Once again, thank you each of you